You work hard your entire life. You clock in, you clock out, you save, you sacrifice, and you look forward to that magical milestone called retirement. And you think to yourself, once I hit 65, I am safe. I have Medicare. Uncle Sam is going to take care of my health, and my savings are secure. I hate to break it to you, but if that is what you are thinking, you are living in a financial fantasy land. And that fantasy land will break you. It will drain your nest egg faster than you can blink. People come to me all the time and say, Susie, I'm fine, I'm on Medicare now. And then a year later, they are in a panic because they are writing checks for thousands of dollars out of their retirement accounts for things they thought were covered. Original Medicare, Part A and Part B, is a wonderful foundation. Hear me now, it is a good thing. But it is not a blank check. It is like a roof with major, gaping holes in it. If you do not patch those holes before the storm hits, you are going to get soaked. Today, we are exposing the 5 massive, shocking things that Medicare does not cover. These are the exact 5 blind spots that derail the most carefully planned retirements. I want you to face these truths right now, because denied numbers always catch up with you. The first shocker, and the one that absolutely stuns people the most, is dental, vision, and hearing. Think about this. You turn 65, your body changes, and what are the 3 things that typically start to give you trouble? Your teeth, your eyes, and your ears. Yet, Original Medicare says, no, thank you. If you need a routine dental cleaning, a filling, a root canal, or God forbid, dentures, you pay for it completely out of your own pocket. If your vision starts to fade and you need an eye exam and a pair of glasses to see your beautiful grandchildren, you pay for it. If you are struggling to hear conversations and you need hearing aids, you are on the hook. And let me tell you, hearing aids can easily run you $3, $4, or $5,000 a pair. Why does this happen? Because back when Medicare was created in 1965, Congress didn't view dental, vision, and hearing as core medical needs. It makes absolutely no sense today, but that is the law. Do you feel that pit in your stomach? That is the fear of the unknown. But fear is a useless emotion unless it drives you to action. So what is your actionable takeaway here? You cannot just cross your fingers and hope your teeth don't crack. You have 2 choices. First, look into a Medicare Advantage plan, also known as Part C, during your initial enrollment or the fall open enrollment period. Many of these private plans bundle in basic dental, vision, and hearing coverage. But if you want to stay on Original Medicare because you want to see any doctor you want, you must purchase a standalone dental and vision insurance policy, or you must explicitly carve out a cash reserve in your high-yield savings account dedicated solely to these health maintenance costs. Do not let a root canal rob you of your travel budget. The second thing Medicare does not cover will absolutely paralyze you if you aren't prepared: long-term custodial care. Listen to me closely. This is the single biggest financial monster hiding under the bed for retirees. So many people tell themselves, well, if I get sick or frail and I need to go into an assisted living facility or a nursing home, or if I need an aide to come to my house, Medicare will pay for it. No, it will not. Medicare will only pay for skilled nursing care. That means medical care designed to help you recover after a hospital stay, and even then, it only covers up to 100 days, and you start facing heavy daily copays after day 20. But what happens if you don't need a doctor or a nurse every day, but you do need help with what we call the activities of daily living? What if you need help getting out of bed, bathing, dressing, or managing your meals? That is called custodial care. And Medicare pays precisely $0 for it. Do you have any idea what custodial care costs today? A private room in a nursing home can easily cost over $130,000 a year. An assisted living facility can run $75,000 a year. Hiring a home health aide to come to your house for just a few hours a day can cost $60,000 a year or more. Too many people think Medicare is free. Let me repeat, Medicare is not free. For Part B, which covers your doctor visits and outpatient care, most people pay a standard monthly premium of over $200. That money is automatically deducted straight out of your Social Security check. And it goes up almost every single year with healthcare inflation. But it gets worse. If you have been successful, if you have a good pension, or if you are pulling significant money out of your traditional IRA or 401k, you can get hit with the Income-Related Monthly Adjustment Amount, or IRMA. This is a massive federal surcharge based on your income from 2 years prior. If your income crosses certain thresholds, your monthly Part B and Part D premiums can double, triple, or even quadruple. On top of the premiums, Original Medicare has a 20% coinsurance rule for Part B. Think about that. If you have a major surgery or a serious illness that costs $100,000, Medicare pays 80%. You are responsible for 20%. That is $20,000 out of your pocket. And unlike standard corporate health insurance, Original Medicare has no cap on your maximum out-of-pocket expenses. None. It can keep adding up forever. Are you feeling vulnerable? Good. Because vulnerability leads to protection. Your actionable takeaway to eliminate this 20% risk is to buy a Medicare supplement policy, also known as Medigap, right when you turn 65. Specifically, look at Medigap Plan G. It is the gold standard. You pay a monthly premium for Plan G, but in return, it steps in and pays that 20% coinsurance and your hospital deductibles for you. It gives you absolute, total predictability. And if you are worried about those high-income IRMA surcharges, you must manage your retirement income brackets layout. Talk to a financial advisor about doing strategic Roth conversions before you turn 63 so that your mandatory distributions don't accidentally push your income over those steep Medicare tax cliffs. My friends, health is your greatest wealth. You cannot protect your wealth if you do not understand the rules of the healthcare system. Don't let ignorance ruin your retirement. Face the gaps, buy the supplemental coverage you need, budget for the expenses that are coming, and take control of your financial destiny today.